Rashed, please.
Thank you, everyone. It was loud.
Yes.
My name is Dr. Rashed Mahfuzullah. I'm currently working, but I gave the introduction already previously, so let's get into that. The main important is I'm a AUSN PhD student. That's the important part over here. So this was actually my master's research, which was on like the disease pattern and the level of knowledge about communicable and non-communicable diseases among transgender population in Bangladesh. The reason I'm trying to quote the word transgender is because of the fact, why do I need to coin them as transgender? Why not coin them as something else that coined the name? Now the second question starts, why do we coin a person either a man or a woman? That's another confusing thing. Because, okay fine, genetically, we term them as a male or a female. But then the question comes, was that the decision of the child himself or herself? Did we decide when we were born, okay, from today I'm going to be called as a man? No. From today, I will be called as a woman. It should have been my choice, right? I should have had the right to call myself a man, a woman, trans, or anything else. I could have called myself a bird, a cat, a dog, anything else, a tree, anything else. That's my right. So, in the stat, we are coining these people. We are coining them into, say, 3 genders: man, woman, and transgender. Well, I guess there are a million definitions about transgenders, who the transgenders are. But the best example is actually given by a person who designed the transgender pride flag, and it shows 5 horizontal lines. One line, the top and the bottom line is light blue. The middle 2 lines are light pink, and the line in the middle, there is only a single line, it is white. The 2 blue lines actually depict a baby boy. The 2 pink lines actually depict a baby girl, and the white line is for people who are transiting, like they are transiting from one gender to the other. So these 5 horizontal lines, which goes parallel to each other, actually shows that you can easily go from one to the other and from the other to the one. It's not rocket science, and it's really open, and it's really easy. It's your choice whether you want to be pink or blue or white. So it doesn't matter. Like, so medically correct terms might be transgender. That is why, or like educationally correct term might be transgender. So as a result, I had to use it because it was this title, not the title, the word transgender was asked upon by my university to term or coin this as transgender. I would have liked to use some other words, but like they didn't allow, so I had to use this word. So as I said before, there are many definitions regarding transgender, but the one I would like to lock onto is people who are genetically male or female, but they want or they are transiting from one gender to the other. Say, I'm a man, quote, but I don't feel like dressing up like a man, the typical exemplary man. I don't feel like, or I'm a woman, but I don't feel like dressing up like that. I don't like the small dress that I have. I don't even like the penis that I have. So, but I like being the other one. I like wearing saris. I like having a bigger breast than what I have now, and I don't like my penis. So let me just throw it out. So this transition is actually what transgender is. Like, I don't know about other definitions, but this is what I understand. It's transgender means transiting gender, or a gender that is transiting from one to the other. Let me give you one official number of transgender in Bangladesh is about 10,000. But as we know, like statistics and in subcontinent, it's really, you know what I mean. So the tentative actual number is about 0.5 million, which is like about 500,000. And there are lots of people, and this statistics was taken, like the 0.5 thing was taken from various communities which work with, or various organizations which work with transgenders. Well, in Bangladesh, why I did this study is because like the studies on transgender is really rare in Bangladesh. The only person to have done another transgender research was my supervisor of this research. So, and that was done about 10-12 years back. And as there are very less research done on transgenders in Bangladesh, there are actually no information about the health-seeking behavior, their disease patterns, and their knowledge regarding these diseases. So as a result, which actually pushed me into taking into consideration on doing this research on transgenders. Fine. My research question was, what is the disease pattern of transgenders in Bangladesh? And the second research question was, what is the level of knowledge on communicable and non-communicable disease among the transgender population? The basic objective was to find out the disease pattern and then to find out the level of knowledge. Other objectives, or the specific objectives, were to explore the disease pattern, to assess the level of knowledge about communicable and non-communicable diseases, to determine or find out a relation between the knowledge level and the socio-demographic factors, and to find out the socio-demographic status of the transgenders. So these are the dependent and independent variables, conceptual frameworks. I took care of a lot of literature, looked into it, and then there were many research that was done in India, and not in Pakistan and others. So it was very rare in other countries, but in India it was a bit more. So like taking into consideration those researches, I built up the other tools for this research. So it was a cross-sectional study. The study time was about 9 months. Transgender population were selected from various regions in Bangladesh, and studying technique was convenient. For my language efficiency and my local tongue, I used Sylhet, Dhaka and Kushtia for taking care of the samples. According to the calculation, the sample size came out to be 422, taking care of the formula, but I took interview for around 180 odd transgenders and stuck to the 171 after cleaning. So the inclusion criteria were transgender people living in the selected 3 areas who were willing to participate in the study, and they understood the nature of the study and the purpose of it and helped me with it. The exclusion criteria were people or transgenders who were severely ill, who could not understand the importance of the study and did not comply with me, and who were previously exposed to the same nature of study, by which I would say who doesn't know. So I had to use a semi-structured interview questionnaire with both open and closed-ended questionnaires. Questions, it was a face-to-face interview. Data collection, after data collection, I put it into SPSS and then and also Microsoft Excel, did the necessary calculations and then pasted them into figures. Then about the ethical consideration, I took permission from the concerned authority. This is an important part. So formal approval, I took it from the Hijra Association in Bangladesh. I took it from the university of mine, took it from the local government that I want to conduct research regarding this. And also informed consent was taken from the transgenders themselves, and it was also informed to them that they can actually, at any point of the interview, they can easily say they don't want to continue with it. And definitely no harms were done to them. So if you look into the results, among the 171 transgenders, I found most people belong to the 15 to 20 years of age limit, 36.8%. And these were new kids coming into the whole community from various parts of Bangladesh. Above 35 years old was 15.8%, so there were a lesser number of very young transgenders, if you want to coin them as, or very aged ones. So most of the transgenders now, they reside in urban places, that is in the city. These 3 places that I visited for data collection was mostly the city, and they were all residing in there. So 74% belong to the urban region for the residents, 16% were peri-urban, and 10% were from the rural area. Educational qualification, illiterate or having no formal education, that was the most, with 47.4%, not educated at all. Primary level education was 26.3%. And as you can see from here, like the maximum higher education was SSC, which is like secondary school certificate. That's 5.3%. So what is the main occupation? What was the main occupation of these transgender people, or the trans people? Mostly worked as, from here as you can see, mostly worked as chanda taker. Chanda taker means like they go to certain shops, they go there, they ask money, that person needs to give, otherwise they show their private parts or do whatever they want. This is more like taking money a bit forcefully from someone, other person. So this is their main occupation that I saw, that they were doing, and that they were open about it. And the next major portion would be the sex worker. So transgenders, this 171 transgender, out of them 32% were working as sex workers. And that was a thing that struck me also, transgenders working as sex workers. And they said that they go to really huge parties, and there they are used as a sexual tool. So they were actually sex workers there. So the income, the majority of the income is between 5,000 to 10,000 taka, which is a very small amount. That's like $300 per day, which is about 8 2s are 12, 8 3s are 24, $3.50 per day. That's their income. That majority, like 77.78%, were earning about 5 to 10,000 taka per day. And according to religion, most of them were Muslims, some of them were Hindus. Let me not get into the academic qualifications of their parents, number of members in the family. So among these transgenders, mostly came from like single families. And the second majority would be the joint families, and 3-gender family, generation families were 21%. So biological children is not a question. So among these transgenders also, like 87%, I found that they were tagged with some organizations. We have the Bondhu and other organizations in Bangladesh. These people were tagged with these organizations. They were under the umbrella of these organizations. But there were about 13% of these transgenders who had no place to live, who were basically on the roads. And they had never had any taggings with anyone. Those who were with the organization, they lived in places where the organizations allowed them to live in. So for example, a big flat where 20, 30, 40 transgenders along with their mother means they term the person who is taking care of them as Ammu. That person is also a transgender, but as he or she is taking care of them, they call them Ammu, which means mother. So when I asked them about like, what were you when you were born? So the answer was, most of them were males and some couldn't answer even. So never, like in Bangladesh, this is the majority that we get. In Bangladesh, we get mostly people transitioning from male to females. So, like according to sexual exposure, most around 5.3% are heterosexuals, 52.6 are bisexuals, who I guess from the previous one statement that they're sex workers, also like helps with that. 36 above among the 171 are gays, and some said that they don't want to label their sexual orientations. So So the main concept was to take note about their health, not the health behavior, the disease pattern. So I had to ask them whether they had any doctor for routine examinations or something, or routine checkups. So most of them said they didn't. So that's the majority of 84.2%. Among the transgender, I was asked to them whether they were taking any hormones for transgender related problems or purposes for the transition from male to female. Some of them said yes, a very less amount, but most of them said no. Regarding breast modifications and stuff, they did not get into all these, because these are costly surgeries in order to enhance your breasts and genitalia. So most of them did not actually get into that. But they were mostly cross-dressing. Cross-dressing would be, I might still have the penis, but I'm wearing this culturally correct dress that is supposed to be there for a woman. So I'm wearing that, but I still have the genitalia and other things. So that was the major proportion of the transgenders that I found. So wear this, and I found about, I guess, out of the 171, only 10 or 11 people who, after they were born, either the penis fell off or it became so small that it was redundant. So, and these people, they sexually or internally, these people, they did not like being a man and stated that they wanted to be the other gender. So this is another thing which I found out there. So regarding behaviors like alcoholic, yes, most of them I found them alcoholic and using tobaccos, and most of the transgenders I found them as sexually active as well, with very high amount of sexual activities in a week. This was another good finding that I got here. Like most of the transgenders, they were using contraceptions. They had the idea of contraceptions and they were using it and practicing. This is the fruit of all the organization working on HIV with transgenders. So any organization who wants to work with transgenders, they are totally focusing on the STDs and STIs and HIVs and other diseases that is related to sex and not to other diseases, the other communicable, non-communicable. So as a result of education or sex education or interventions given to transgenders regarding this, and teaching them how to use contraceptions and providing them with it, this actually helped them to follow the contraceptive rules and everything much more properly. So as a result, this is one of the findings or the fruit of this, that most of the transgenders were using contraceptions. And the most contraceptive method mostly used was condoms. Sure. Regarding them using any substances, yes, as yaba or I forgot the name of it. Yaba is a very locally found drug. So they are using yaba. They are smoking or taking marijuana, and that's the practice also now. Either they were previously using it or they were using it at that time. Regarding disease pattern, if we go along with all these, what I found out was okay. So if I go this a bit faster, they were not suffering from any illnesses for the last 3 months, mostly. About only the type of problems that they were finding out was 10.5% were suffering from fever, 26.3% were suffering from pain, nausea no, vomiting yes 21.1%, and bleeding 21.1%. So when it was asked to them whether they were suffering from any seizures or anything, mostly they said no, and they were not having convulsions. Some of them, yes, were suffering from, according to the statistics you can see, some of them were actually suffering from chest pains, and some of them also had they were terming it as heart attack because it was severe chest pain to them. And also along with that, when it was asked to them whether they had blood pressure related issues, they said yes, they have diagnosed high blood pressure or they were thinking, or they were told by other people or other NGOs working with their health, that this is high blood pressure. So they were terming it as high blood pressure, and a majority of the proportion of these transgenders, they were having this hypertension. So mostly no one had cancer. Regarding the abdomen, this was one very common problem that they were finding. This might be related to the their feeding practice of what they were feeding on or what they are eating, or maybe not eating for a long time and then eating spicy food wherever they're getting them from. So as a result, they were suffering from gastrointestinal problems, which is like some peptic ulcer type things, or from like gas formations or pain in the abdomen. Most of them, they said that they did not have diabetes. Some of them definitely said 10.5%. Regarding urinary problems, another common problem that I found out in them was, according to these people, they were saying they had back problems, they had muscle problems, they had problems with bones, and say for example like injuries was joint injuries or joint pain was much common in them. This might be you can you can actually think about the fact the work that they're doing, like long time they're walking outside, they're either going to parties and dancing, or they're working as like sex worker, which is like multiple sex on a single night. So as a result, these might have, or people beating them up, these were some of the stories that they said. So these were maybe reasons that they were having these problems much more. Skin problems was, yes, very common because of like the unhygienic situation that they live in, the congested situation that they lived in. So that also resulted into getting one skin problem, like one communicable skin problem to them from one to the other. So if I go a bit faster, most of the information that they got was from TVs, and secondly the highest would be from newspapers, which they directly perhaps did not read. Some of them could, but which was read to them by their mother, by the Ammu, as I would call it. So regarding the knowledge level, that's me with them, happy people. So let me just go a bit faster on this. Regarding the knowledge level of diabetes, I asked about 5 communicable diseases and 5 non-communicable diseases. I asked about the features of these diseases, the complications, and the preventive measures that there might be. And I had my preset answers, which I got from many sites and many books. So that preset answers had scalings, individual scalings. So for example, it was if the proper answer was 7 answers, these are the 5 features of diabetes. So according to the Likert scale, I broke it down. So if it is lesser than 3 or lesser than 2, it's not good knowledge. If it is more than that, it's good knowledge. So this is how each question was broken down according to the Likert. So then I asked them about diabetes, asthma, hypertension, cancer, and malnutrition, musculoskeletal disorder. So after asking them questions about all these, the thing that I found out was like 18.71% or 18.71% people had good knowledge about these non-communicable diseases, and 81.29% had poor knowledge. Taking into consideration the communicable ones, I asked them about diarrhea, about TB, about STI. In STI, the knowledge level found was really good. I asked them about UTI, scabies, dengue, hepatitis. And here I found out that satisfactory knowledge was found 20.47% and 79.53% had unsatisfactory or poor knowledge. So when I tried to find out association between them, these black colors are the things where I found the association in. So there was association between the knowledge level on non-communicable disease and the age of the transgender with the age, yes. And then with educational level, there was, cause we can see from here the p-value is less than 0.05. So there is statistically a relation between the two aspects. So there was also association between, or relationship between the non-communicable disease knowledge and the main occupation. So those who were sex worker, they had more or less good knowledge regarding some of the non-communicable disease. And there was also relation between the income and the knowledge level as well. I did not find any relationship between the religion and the knowledge level. Yes, I found about the whoever termed themselves as, yes, they are transgender. These are the people I found out they had more knowledge regarding the communicable disease or non-communicable disease. So, and also another thing, there was significant relationship between people who had more sexual exposure as a transgender. These are the people who had more knowledge about non-communicable diseases. So, and this is about going into the communicable disease one. So mostly, if we get into the whole thing, this is a few of my findings and the implications that might bring from this study. The study was done among the transgender who are actually a very sensitive group. In only Dhaka city, in a congested 2 or 3, 4 regions, there are about 30,000 transgenders there, only in that specific section of Dhaka. And as we found out from everything, these are the people who were not getting any medical assistance. Yes, they were getting a bit of medical assistance from the organizations they are turned with or they are tagged with, but other than that, whenever they even go to other doctors, or normal doctors or general practitioners, they were not seen properly, they were not prescribed, or they were not given the medical attention properly. Secondly, as I also found out, like, there are floating transgenders. So, and as we saw that, as one of the other findings was, the people who were tagged in with organizations somewhat had better knowledge about diseases or about health-seeking behaviors. So what I would like to suggest was we take these floating transgenders and bring them under other organizations so that they get more information regarding all these. The third part would be we have very lesser researchers regarding transgenders, so this study might give us an idea about what the disease pattern is, and people from here can then just like pick from there and go to specific or check around like specific morbidities that they might find among the transgenders. As we can see, like most of the transgenders were suffering from gastrointestinal problems and musculoskeletal problems. So, like, and throat infection was also common with high percentage of allergies. So these are the morbidities which we might take into account and then give intervention so that these becomes reduced a bit and their health condition improves. Regarding knowledge, yes, the overall knowledge level is poor, but surprisingly, the knowledge about STI was very good. This may have been accounted due to the intervention by NGOs that I said a bit before. So from here, we can deduce the fact that if proper health education is provided, then the knowledge level from other diseases can also be improved on. So, taking into account both, there was a relationship between many factors, the socio-demographic factors, and the knowledge level. So we can also try to improve on the socio-demographic statuses, and then as a result of improving the socio-demographic status, it would improve on their knowledges on health, and that would also improve their overall health pattern that they were going through. As the knowledge of non-communicable disease is less, the transgenders are suffering from non-communicable disease more, so we can also take steps to improve the situation. Some of the recommendations are placed over here, and most of them I have already said, like tagging with organizations, giving them more health education, giving them medical proper. Being a doctor, I should not be biased. That's the truth. So whenever a patient comes in, that person is a patient, that's it. We should not care whether that person is a man or a woman or a trans or whoever that be, and whoever wants to coin them as what. As a medical practitioner, the idea should be giving health service. So the behavior of the doctors themselves, health practitioners themselves should change so that these people can be addressed more and not being biased and saying, no, we don't want to see you just because you're a trans. So we should respect them appropriately, and surely we should be open ourselves so that we can give them much better health services, and henceforth we can improve their health situations or conditions as well. So whether I term them as man or woman or trans, they're ultimately humans. They're ultimately living organisms. They have lives. So as a result, they have their rights as well as human beings, as living organisms. So taking care of that, yes, let's all, whoever are there in health, health practitioners or whoever they are out there, my plea to them would be, let's open ourselves up, let's treat humans, let's treat life, and let's not find them as anything else and be biased to them. So with this, I would like to end my speech. Thank you very much.
Thank you. Can I ask a question? Did you ask them before, as young children, were they street kids, or what was the occupation between 0 to 5 or 5 to 10? What was their background?
Like, these were many of the stories that were told to me by them. Some of them would be, when they were born, they did not feel like going to schools. They were mostly people in villages, kids in villages, and they never liked getting out and playing cricket, playing football, or doing other like male activities that it might be termed as. So where they used to love to stay in the kitchen, work, dress as a bit like taking the dress of the elder sister or younger sister, wearing them, putting on makeups, putting on lipsticks. So these people as children, when I asked them, like they were saying mostly they used to stay home rather than going out, or even if they used to go to schools, some of them, yes, they did go to schools, as we can get from the statistic, but these people, they never liked being there for long. Because another reason for them not liking schools was that due to some of their activities that they used to do, like say for example, talking a bit, say for example, if we say a girly way, so this is the reason, and they had no beards, even if they were of a certain age. They were not growing beards, they were not growing facial hairs, they were not having voice changes. And due to some of their like hand gestures or walking gestures, other people, other friends, they used to take, they were not behaved properly with. So that's some of their thoughts about this. So they were not behaved properly, and that's another reason they plan to skip school and get inside home much more. And at certain point when everyone was doing this to them, at one point most of them also thought, we won't even live here at this place. So let me just get out and just be with all these people who are of my type. So that's also what pushed them out from their own homes. So yeah, this is how
Thank you. Other comments, questions?
Yes,
Yes, please.
Rajiv.
Rashed.
Your title is very nice. Knowledge on communicable and non-communicable disease among teenagers population in Bangladesh. So you mentioned lots of disease in there, and section is also put here. Rajiv also just sex education, but you were communicable, non-communicable, different disease in there. But no mention there is oral health sector and communicable, non-communicable disease in the whole body.
Right.
Because we know anus is better than for mouth. So, so many bacteria in here, hand, foot, mouth disease, and sexual transmitted disease also HIV, STD, and also you mentioned there another disease, sexual transmitted disease. Yes, STDs. Yes. So there are also so many times, and 90 to 96 or 8% is become transmitted by salivation, and sterile composite multicellular sandwich also communicable to the people, and does this everyone. And also communicable disease also oral hygiene is important for whole body is protect the whole GI tract, cardiovascular disease, and also bones. Yes, because it does with blood. Okay, so diabetes control is also control is part, yeah. Because not mouth is bacteria attached the gingiva, so it's a thin and very fine bacteria is there living here, and alive part. Whole body is there is outside no alive, but mouth is alive, so bacteria is alive this part long time. So it's most important cleaning the oral hygiene, not the teeth, tongue, and soft palate and hard palate. Hard palate and soft palate is tongue. Also is lots of bacteria there. Okay.
Like truly, Abu, I'm really thankful for this question.
Yes, because it's communicable, non-communicable. It's not communicable.
Everything is connected.
Yes, connected. But is your data is so part is touches, but not is
yeah.
oral
I
and
so
oral
wish, Abu,
hygiene
I so wish I could have talked with you before my research and made you talk with my supervisor, because the initial title also had about hygiene practice, which includes not only hand washing,
is gram positive bacteria.
Which is
everybody is a headache, diarrhea, lots of motion, and lots of water, and safe drinking. No, hygiene is where.
I know, I understand up your question, but my concern was
I also complete from ICDDRB from diarrhea, so that's why I am outside in dental community, because when I prevent dentistry and also control this my area, so I need to talk with different type of community. So I'm out from dentistry. Okay, Najib?
Yeah, Abu, the thing is that this is what I'm saying is that my initial title also had regarding questions regarding, or title or section regarding hygiene practice, which starts from what Sir said about hand washing, that's hand hygiene.
Also handful mouth.
Also like anal hygiene.
We are entire in mouth.
And like
no,
reproductive hygiene. Abu, that's what I'm telling you. If I can get time to answer. So it also included questions from all these hygiene things, and also which included oral hygiene. But as you can see, it was already a big list of questions. So as a result, they asked me to focus more on this now, and later on, when I want to do another research, I can focus on that, so that it becomes more specific. So that is the reason Abu, I had to skip that and put on this. I understand, but there are also other diseases as well.
So many diseases you mentioned and put it there, and result is from there. But no anyone, any topics.
Yes, the causes, I'm not a dental specialist.
Not dental specialist. Communicable is update. You are not searching an update research.
Maybe Abu, the next research that I can do is with
not
taking help
because
from you.
Worldwide is so important in everything. Everywhere is.
I understand, but I'm not a specialist on that, Abu. So as a result, I did not want to focus on that.
But it's not accepted.
Okay, thank you. Any other questions or comments? Yes, please.
Okay, Rajiv, thank you for such knowledgeable information. And I want to congratulate you first. Because we talk about them more, but nobody is there to work on the ground.
Right.
So you have done on the ground, so congratulations. My question is that if you want to convince somebody or make them a part of our society, then I think you should have to tell them that we are same. Just you have told us that there is no difference between us. There's like if somebody born male but his features are female, it's all about genes.
Right.
I am not a biological student, but I can understand this.
Right.
But if you want to convince the people, like there are people in the society, you say no, these are the people which are a part of our society only.
Yeah.
But they will not accept it. Like, you are getting me what I am saying. That you need to tell them, like, if I have to convince my people
Right.
that these are not different, these are part of life. So I tell them that in our Hindu scripture, we have talked about the third power, like transgender. In Hindu culture, we call them hijra.
Right.
Hijra.
Hijras.
And I tell you, if I want to convince them, then I say that in our marriage, when our marriage happened between couples, these transgender used to come to the marriage and bless the couple.
People, right?
Yeah, and if it is assumed that if they don't come, it
The marriage won't be blessed.
mishappen. And secondly, if a newborn baby born in some family,
Right.
then these people also come
Right.
and bless that child.
Bless the child.
You're getting?
Yes.
So this so that how we give respect to them.
Right.
But what happened now traditionally, we have forgotten these things, and
Right.
due to the knowledge we have not transferred to our generations, and now they are become separated from the community.
Right.
So how will you convince them? I just like medical is a part. I can understand you are just you are from one field, doctor, but there are many issues like education also there,
Right.
health is there, but for providing them these opportunity, you should first make them part of our society.
Right.
So what we should do constructively on the ground.
Like
so that
my
we can
answer
work.
to that would be, it's about like the human body. A cell, a group of cell makes tissues. A group of tissues make an organ. A group of organ makes an organ system. Many organ system makes the whole human body. So if I need to change anything, I need to first change myself. So if say for example, in order to bring any change, I need to change myself first. And then like Viva Vosh, I talk with you, I talk with other people. Maybe you are afraid of transgenders, maybe you have some other ideas of transgenders. But I can be the person whom I can pass you the message, because being with them, I have understood certain things, maybe I've got some certain informations and stories, emotional stories, which after hearing, you might also think, no, these are actually people who need care. So I would say it all should start from one, and that one who has got the information regarding this, they can slowly and slowly pass it on to other people as well. And with this spread of knowledge between people, like from this gathering, so from this, if we start spreading the messages, I guess at one time will come that the whole society or our own society will know about transgenders, and perhaps they won't be they won't be afraid of them, and they will support them even more regarding everything. So yes, if I would say, the change should start from our own selves. So yeah.
Thank you. Any other comments? I think it's very thought-provoking, and I think your definition of transition as a trans was very useful as well. Okay. Because on some forms you'll see you have to identify your gender. And so in some, I guess on the AUSN admission form I should also make it just open. Please write your gender. Rather than other, it may be better just to say write your gender, and not to have a category box to click.
Right.
And then you can self-identify. Yeah, thank you very much to everyone.
Thank you.
Thank you.